think post-COVID, we're doing more and more online, which has advantages when bringing together people from different departments and institutions, perhaps, and also allows colleagues from places like Kleintjes here. See a few people are joining us from different hospitals, which is great. Not sure what the etiquette is. Do we start at 12:30 exactly, 12:31, 12:32, or it is 12:32, so let's go with that. Professor Kleintjes needs no introduction because she is our Professor of Intellectual Disability in the department, has been with us for some time. But I think perhaps the South African Child Gauge needs just a word of introduction, because that's something produced by the Children's Institute, which has been around at UCT for some decades, initially led by Professor Marianne Jacobs, pediatrician interested in community pediatrics, and now where Laurie Lake lives and works. And I see that this, we're very lucky that one of the recent editions of the Child Gauge focused entirely on child and adolescent mental health. That's the edition of 2021-2022, headed up by our friend and colleague from Stellenbosch, Mark Tomlinson, by Sharon and by Laurie. And so that was really a mammoth task. Not quite sure how they pulled it off. It's a lengthy, comprehensive, up-to-date document, which anyone interested in child and adolescent mental health should know about. I see a lot of child and adolescent people online already, which is wonderful. And without further ado, over to the two of you. Thank you so much for being willing to talk to it.
Thank you, Dan. Just want to check that you can see my slides. Just give me a thumbs up, that would be good. And just to say what a pleasure it is to be here and to be representing the Children's Institute and the incredible team effort that underpins each issue of the Child Gauge. And perhaps just to say a brief word about the book, because it's not an ordinary academic output. What we do is we aim to draw on the best available evidence, and then to package it in a way that is both relevant and accessible to decision makers. And that's decision makers both at the level of government policy, but also to professionals who are responsible for the delivery of services to children. And so when we're looking at the child and adolescent mental health gauge, this is the fruits of a collaboration with over 90 contributors from around the country. And what we did is we brought together people working from different disciplines, looking at different dimensions of mental health and well-being, and really engaged in a deep conversation about what is child and adolescent mental health and what can we do in the South African context to improve it. And as you can see, the sort of subtitle or subtext is the recognition that child and adolescent mental health is a catalyst for development, both for the development of individual potential and for us as a nation. So the first chapter was led by Sharon, with contributions from Tony Abrams, John Pikoyako, myself and Mark. And really what we wanted to do with chapter 1 was to shift perspectives. As we know, there are many different perceptions around what mental health entails, and it's all too easy to collapse into a conversation around mental illness or mental health problems. So we drew quite strongly on the World Health definition of mental health. So we're interested in supporting children's ability to act with agency, to create environments that support young people's ability to reach their full potential, to engage in meaningful relationships, And in particular, in the context of COVID, which is was live and centre of the conversation we were working on the gauge. So in the context of COVID, in the context of climate change, how do we equip young people with the skills to adapt and cope with adversity, and to play a meaningful role within their families and communities? So very much a positive, life-affirming definition of mental health was a key consideration. The second was introducing this notion of mental health as a continuum, and to emphasize the fact that we are all moving back and forth along this continuum in response to life's challenges. And this is a really important narrative because it helps to disrupt some of the stigma that contributes to the silence around mental health. And I think we were very lucky to be producing this book in the midst of COVID, where there was a real genuine concern, not just at the level of government, but also at the level of schools and within families around the impacts of COVID on not only adult mental health, but that of children and adolescents. And with that concern, we saw a slow opening up of conversations around mental health and well-being. So that was a really useful window of opportunity for us. And then, of course, if we're looking at mental health across the continuum, then we need to be thinking about a whole range of interventions. So not simply a narrow focus on the medical treatment of mental disorders, but shifting all the way back along that continuum to think about prevention and what can we do to enable children to thrive and to build their resilience. So that was chapter 1. Chapter 2, which was led by Craig Lunt and his team, together with Cass Thorsdale, Zulfa, Emily and Claire, focused attention on the social determinants of health. So a very strong recognition that mental health doesn't just exist in our heads, and that it is shaped in incredibly powerful ways by the environments in which we live. And therefore it's incredibly worrying that 6 in 10 children in South Africa are living below the poverty line, and that 42% have been subject to either physical or sexual violence. And this is data that comes pre-COVID, pre the war in Ukraine, pre the impact of rising food and fuel prices on families' incomes and children's ability to access care. So it's not surprising then that an estimated 1 in every 5 to 10 children in South Africa are struggling with some form of mental disorder or psychosocial disability. So environments matter. And if environments matter for mental health, then we need to also be thinking about interventions that, again, extend beyond the healthcare service and supporting individual children to start to address some of the structural drivers of mental health problems. So this chapter has a really strong focus and emphasis on addressing poverty, inequity, discrimination and violence. And that, of course, requires a whole of society, whole of government response. The third of the framing chapters focused attention on the need to adopt a life course perspective. We know that early experiences and relationships, especially exposure to toxic stress and or adverse childhood experiences, can have a lifelong, if not intergenerational impact on health and development, where both positive and negative experiences and exposures can accumulate over time in ways that can become hardwired in the developing body and brain. For example, we know that maternal depression is a key risk factor that impacts on responsive caregiving and attachment. So there's a real need for us to be intervening early in the antenatal period, if not preconception. At the same time, the chapter also recognizes that these pathways are not necessarily written in stone, that there is always an opportunity to shift the balance, to promote mental health by strengthening the protective factors, for example, by investing in positive parenting programs or anti-bullying in a school setting. So the chapter calls for not only early but sustained investment in children's mental health and well-being to ensure that the early gains, and in particular we've seen a very strong emphasis on the first 1,000 days of life, to ensure that those early gains are not eroded, but continue to be supported all the way through to adolescence. And the chapter also includes a very strong focus on emotional regulation and executive function. So how do we start to build again children's capacity to cope with stress, to plan ahead and to problem solve? And there's a really fantastic case, detailed case, drafted by Tamsin that focuses on how better to support children with conduct disorder. The following 3 to 4 chapters then start to explore different platforms for intervention. And we know that families are the foundation for child and adolescent mental health. There's a beautiful, in fact, the chapter opens with this beautiful quote from Archbishop Tutu, that children learn about the nature of the world from their families. They learn about power and about justice, about peace and about compassion within the family. And whether we oppress or liberate our children in our relationships with them will determine whether they grow up to oppress and be oppressed or to liberate and be liberated. So what happens within the walls of the home or within the confines of the family is fateful or often fateful. The chapter then goes on to make the point that it is not about the family form. It's not a question of the shape and composition of the family, whether you're looking at extended family, nuclear family, or a lone mother caring for her children or a lone father. It's not the shape of the family that matters, it's the quality of relationships within it that determine the impact on children's mental health. And that includes things like protection from trauma, their ability to access education, early learning and stimulation, and the provision of sensitive and responsive caregiving that can help to build children's confidence and self-esteem. And that in itself, of course, is a foundation for learning and development. At the same time, we know in the South African setting that families are struggling, that poverty, unemployment and inflation have placed incredible stress on families and have often fractured the relationships within them in ways that spill out into conflict and violence. So families themselves also need support, and the state has a duty to provide that support. We know that there's strong evidence of the benefits associated with the child support grant, that despite its really small financial value, offers a regular source of income, and with that a measure of stability that allows caregivers to plan ahead. But we also know that we see far stronger benefits when we combine interventions, when we combine cash with care, and when we couple access to social assistance with parenting programs. The following chapter looks at schools as a second powerful platform for intervention. And again, it calls for a suite of interventions, from health promotion and prevention on the one hand through to more focused treatment and recovery plans, including measures to help learners reintegrate back into the school community after a period of mental illness. It highlights that there are a whole range of policies and programs in place from the care and support for teaching and learning programs through to the National School Safety Framework, the life skills curriculum in schools, and of course the school health services. So the vision is there, the policy framework is there, and yet implementation remains incredibly weak, as does coordination across a range of service providers, which mean that children all too often are falling through the cracks. The chapter also highlights other priorities. It calls for greater investment in the mental health of teachers, as well as capacity building so that they are able to support children's emotional well-being, to manage challenging behavior in a classroom, and equally importantly, to be able to identify and refer those children in need of additional support. And then last but not least, the chapter highlights the need to support children through key transitions, the transition from early childhood development programs into that first year of primary school, and similarly the transition from primary to high school, when children are particularly vulnerable as they navigate and negotiate a strange and potentially hostile environment. So a really fantastic chapter led by Sarah Skeen and the team at the Institute for Lifelong Health Research at Stellenbosch. The following chapter turns to the role of the health service and focuses in particular on that treatment gap. And so we know that only 1 in 10 children with a diagnosable or treatable mental health disorder in South Africa is able to access care. And that's a telling indictment on our healthcare service. We know that those services remain concentrated in urban centres and are almost invisible when they move out to district level and into the more rural parts of the country, and that where services do exist, they are hamstrung by limited staff, space, and training. The chapter makes a really strong call for leadership, and it's been wonderful to see, in a sense, the Western Cape take the lead with the appointment of Renee Nasson as the provincial lead for child and adolescent mental health, and to see this commitment to strengthening services at a district level. The chapter outlines a vision for child and adolescent mental health services, which is captured in the graphic on the slides. And it talks to the importance of training and task sharing, combined with supervision, so that we can begin to build capacity across the system. At the same time, it also emphasizes the need to support and develop the mental health literacy of teachers, of ECD practitioners, parents, and children themselves in order to promote care-seeking behavior. So that at the end of the day, we can build a more healthy, integrated child and adolescent mental health system. And perhaps the one thing I do want to flag about this chapter is a case that highlights the ways in which the children of parents with mental disorders are particularly vulnerable. And very often when we're talking about children, we're focusing attention on children's services, and we're assuming that that is the space where the work needs to be done. But what this case makes abundantly clear is that we need to begin to adopt a child and adolescent and or family-centered approach to the care of adult patients within the mental health system. We need to be asking, where are the children left at home, and ensuring that they access the necessary support and care. So hoping that that's something that we can carry forward in the discussion at the end of the lecture. The following chapter focuses on children in the digital world. It draws on the work of Roshana Desai and Patrick Burton, and it highlights the ways in which social media are both a potential threat and opportunity to build young people's mental health. And it also highlights the ways in which we need to do a tremendous amount of work to build the capacity of schools and of parents, and of course children themselves, to navigate this space, both safely and with great respect and care for the ways in which we communicate with others. So definitely well worth a read. And I think when we were developing a set of child and adolescent-centered materials to accompany the Gauge, this platform came into much sharper focus, certainly for me as a communicator. The following chapter looks at violence against children and adolescents as a cross-cutting theme. We've already spoken about the ways in which 1 in 2 children in South Africa have been exposed to either physical or sexual violence, but the rates of violence or exposure to violence are far higher in certain communities. For example, the Birth to 30 cohort study led by Linda Richter found that 99% of children in Soweto had been exposed and or experienced violence in either their homes, schools, or communities, and very often across all those different spaces. So repeated exposure to violence over time. We also know that while the forms of violence persist across the life course, that each encounter, each violent incident and exposure increases the risk for PTSD, depression, anxiety, and substance disorders. And at the same time, it also increases the risk for further victimization or perpetration. So what we are growing respect and understanding for the ways in which early exposure to violence, such as harsh physical punishment within the home, how that is part of an intergenerational cycle of violence, and that we need to be, again, intervening really early on and to be offering support for families and caregivers of young children in particular. The chapter also focuses attention on the intersections between violence against women and violence against children. These tend to co-occur in the same households, they share the same risk factors, and therefore we need to be shifting towards a much more integrated approach in our service delivery. So when we are responding to a case of domestic violence, again, we need to be asking, where are the children? How can we support them? So looking beyond the adult index patient. And then similarly, we need to recognize the ways in which violence against children, and particularly sexual abuse, is likely to re-trigger caregivers' own childhood experiences of violence in ways that may make it difficult for them to provide the necessary support to their children. So the chapter itself is calling for a trauma-informed approach, not only to the delivery of child protection services or policing, but also, given how pervasive violence is in our society, we need to be thinking about a trauma-informed approach to schools and education, to healthcare services, to justice, and to youth-based programming. And there's a fantastic case looking at a youth-based program and recognizing just how many young people on that program are struggling with violence, with trauma, and with mental health problems that are making it more difficult for them to make that really important transition from school to employment. So yeah, one of the case studies certainly echoing the call within the violence chapter. Chapter 9 is focusing on the intersections between disability and mental health. We know that children with disabilities and their families are particularly prone to mental health problems. And that's in part due to the difficulties that they encounter, the many barriers that they encounter in accessing healthcare, education, transport, and other services. And the ways in which these barriers are also coupled with high levels of stigma, bullying, and discrimination. And that's on top of course, the everyday demands of coping with an impairment. We also know that mental health problems and disorders can, in and of themselves, become disabling and impair children's functioning and ability to participate in home, school, and community life. So this chapter has a really strong emphasis on addressing discrimination and exclusion and enhancing participation as a key ingredient and pathway to promoting mental health. The chapter calls for, oh goodness, sorry, I've not moved on to the slide, I'm so sorry. The chapter also calls on us to adopt a twin track approach. So on the one hand, there is the need to provide disability-specific support services to build the capacity and to empower young people with disabilities to participate actively and to speak out and to claim their space. On the other hand, we need to do a lot more work to mainstream disability, to challenge some of the discriminatory attitudes and practices that permeate our schools, our universities, and our healthcare system, and to create more inclusive, more welcoming environments that help to level the playing field. And again, that is a critical foundation for mental health. The final chapter calls for us to put children at the centre of our efforts, the centre of our policy, the centre of our programming, the centre of our efforts to build back from COVID and to prepare for the challenges of climate change. The individual chapters speak to the important role of the family, the school, the healthcare service, and of course, the child protection system. But it is only when these different pieces of the puzzle knit together that we can ensure that children are adequately supported, that they are not left to fall through the cracks, but rather that we have created clear pathways for them to access the support they need, and also to find opportunities to succeed. And perhaps the final call, I guess, running through the concluding chapter is a call to build agency, to bring young people in as partners in finding solutions, because it is through our agency and through our action that we are able to transform these challenges that we face as a society into a source of social solidarity, of belonging, and of hope. So that's it from me. I'm going to hand over to Sharon, who's going to reflect on what this means for us as a university and for us as a department.
Thanks, Laurie. And good afternoon, everybody. Was wonderful to be part of this initiative because people may not know, but I actually have a very strong interest in child and adolescent mental health that goes back quite some time, having completed the MPhil in child and adolescent mental health in 2006 at the Child and Family Unit. So this really feels like part of my this group feels very much part of my professional family. So Laurie's just spoken about the concluding chapter, and at the end of that chapter, there's a series of recommendations which you can see Laurie, myself, and Mark have pulled out as key areas that try to cover the very large range of considerations we need to take into account with children and adolescents and their sports systems. Looking at putting children at the center of policies, practice, and service delivery. Doing so when strengthening child and adolescent mental health services, but to do this in the context of the influence of broader social determinants of mental health, and acknowledging that, a whole society approach is necessary, which needs to draw on other sectors, other departments and partners in addressing the needs of children and adolescents with and without mental health problems, because as Laurie was saying at the beginning, we need really to be intervening early, as well as offering supports to children and adolescents with existing mental health problems, and also to recognize that children and adolescents with mental health problems themselves need not only mental health care, but support for preventative and early interventions that affect their lives outside of the direct service delivery platform. And that we need to take an intergenerational approach to this, realizing that when that child and their support system is in front of us clinically, preventatively, that there is a whole history of impacts that we need to take account of in designing and interventions and assisting them to overcome what can be, historically quite a much broader set of considerations than just the presenting problem in front of us. And that we do have quite good policies and plans in our country based on international best practice, based on evidence, which many members of our department and other departments, mental health partners in the Western Cape and nationally have contributed to. But the difficulty lies in the implementation and resourcing of these policies and plans, and that really our work needs to be shifting now towards looking at the, bringing evidence to the interventions, as which Laurie outlined, various areas of interventions that have begun to show early evidence of being able to support families and the children in these families and impact on mental health outcomes. And that we as a body of academics and academic clinicians need to be open, agile and responsive and resilient ourselves, given the stresses and difficulties of working with this complex situation. I could go to the next slide, please. So I thought maybe just, Laurie, would you be able to move to the next slide? Naima, if you could move to the next slide, please. Thank you. So I thought just to reflect briefly on the implications for ourselves in our role as academics and academic clinicians in terms of our own KPAs and focus areas in our work setting. And Laurie has already spoken to the wonderful chapter by Rena and Peters and other colleagues on the direct service delivery and the work that's been done there. So I will focus on teaching and learning, social responsiveness, and other research. So firstly, in the area of teaching and learning, if we could reflect on whether we do already or could improve our focus on integrating the social determinants of mental health and mental disorders in our teaching and engage students on the implications of this for practice as health professionals in our context, or soon to be health professionals in our context. Are we taking a life course and intergenerational approach to our teaching and learning, which places children, adolescents, and their support system as a key focus for our teaching and learning? And that when we teach about delivering services, that we remember that though we might be in an adult service, this actually happened to me when I moved from the female lockup wards at Falkenberg to the child and adolescent service, and saw how presentations in the child actually was not really the child that needed treatment, but I actually had to refer the parent who was there to the female lockup wards. And then I reflected on how in the female lockup wards, I would be doing a adrenogram and taking down the number of children in the family, but not necessarily reflecting as profoundly as I should have on what was happening to those children and adolescents at home while the parent was receiving treatment. So are we taking that with our students, asking them to look at the family from whichever point, whether it's the child presenting, the mom, the dad, or whatever, that children and adolescents should be thought of actively in our service delivery. And then working as health professions within a multi-sectoral space, are we also trying to help our students to be thinking about that and how they need to, as health professionals, work and engage, with other sectors respectfully, and because there's so few of us, but we forget that when we, again, I was busy with a research project on suicide prevention at some schools in a local community, and was surprised to find that the EMDC psychologists felt alone, the mental health nurse at the clinic that I passed on my way to the school felt alone. Everybody was feeling so lonely. The social worker at the district hospital felt alone. But bringing them together in a meeting, they were able to see how they could support each other, as part of a district-based support service. And are we actually training our professionals to do that resource mapping so that you can draw on everything? And I think Renee and colleagues are busy working on that. But I think we need to be introducing that skill at teaching and learning level. And then also looking at human resources, mental health. We also need to be considering more actively the integration of Indigenous perspectives in our curriculum and clinical training, rather than only focusing on, what we traditionally teach in our context. And then the impact of discrimination and exclusion on access to quality healthcare and other services which can enhance child and adolescent mental health. Are we helping our students to see how these contextual issues can affect teaching and training, or rather service delivery and access and uptake of service delivery? And then lastly, do we train our professionals to see that they have a role in developing and influencing policies and implementation strategies as part of their scope of practice? And I think many people in this room have been inputting to these policies and planning documents. And we have good examples of national policies that have been written, and the research has been done by members of our own department and colleagues, we work with closely at other universities. But I think that people are trained to be service deliverers or practitioners, but not necessarily looking at how they can also bring their expertise to other avenues, such as policy and planning. And then on the next slide, research and research. I think, as I mentioned, noticeably in the implementation of mental health policy and legislative developments in the past 25 years, we haven't really been focusing on the deeper structural inequities which impact on mental health of children and their families. The evidence points to the importance of social determinants. We have it included, if you look closely, in our policies nationally, but we are still, and this is important, focusing on service delivery, important because of the poor resourcing, because of the lack of implementation support, as the services chapter points out. But really, we need also to be looking at these broader implications in terms of interventions. And great that there is early work looking at how to combine these issues, as Laurie reported earlier. There is need for further research on the links between socioeconomic conditions and mental health. And in our department, the Center for Public Mental Health and its partners, our Addictions Division and the Division of Child and Adolescent Mental Health, including the work of CARA, the Center for Autism Research in Africa, are working on this. And I'm sure there's others that I have not mentioned. And then another area of research is the research to inform the strengthening of mental health service delivery. And Laurie touched on the work that Renee and others are doing in this in this province. And just to bring to your attention a recent ASIC webinar report that reminds us that research to inform practice is also still needed in terms of collaboration in care between our current mainstream mental health practices and traditional Indigenous practice for mental health care. We talk about it, we have ad hoc reports of how it's working, but sustained research to bring our desires around this area and our ad hoc experiences with this area into mainstream practice is still, according to this report, and I think our experience, far off the mark. Two last points here. The National Health Insurance Bill, it really worries me. The bill is very much in progress, and yet I maybe it's just me, but that's unaware of it. But what are we doing to input actively into the programs, the delivery programs, the accreditation standards, the contractual conditions for service providers, the treatment programs, every other program that I can think of, the oral health program, the eye health program, they all have their programs. Where's the mental health programs that is nationally accepted and that will be automatically be drawn into the new health system if it goes ahead? I think there is a need for us to look at that, and particularly for children and adolescents, as the South African Human Rights recent report on the state of mental health services has done. Children and adolescent mental health services has really been highlighted as a priority area for action. So I would look forward to seeing what we are doing about making a footprint on that new health system. And then social responsiveness, if you can go to the next slide. And this slide is a slide from Laurie, which provides examples of awareness-raising initiatives post the launch of the Gauge, examples which speaks to activities we can engage in as part of our social responsiveness, this lecture being an example too. There's plenty of opportunity for us to share our expertise by contributing to social media platforms on child and adolescent mental health and well-being, to write accessible pieces for child, which is child and family friendly, that reaches community and district-based public service providers within and outside of the health system. And then, as I intimated earlier, to actively be monitoring developments in and being up to date on policies and guidelines, and bringing your expertise, your clinical expertise, your and knowledge to inputs on those developments. I think the last one that our division, for example, input to was the regulations for the licensing of community mental health services for persons with severe and profound ID and persons with mental disorders, published in June 2022. We set out very stringent hospital level guidelines for community-based NGOs to develop services, which, if published as in its current form, will have, I think, fairly severe impacts on the already constrained availability of these NGO-run services. So yes, I think I will leave it at that, to have some time for questions.
Okay, so great, Laurie and Sharon. That's really a comprehensive overview of an enormously important document. Open things up to comments and questions from everyone on the internet.